According to the UN, more than 11,000 children have been killed or wounded in Yemen's civil war since it began over 8 years ago. That is an average of 4 children per day since the war began in 2015. However, the exact toll of the conflict is likely to be significantly higher. Thousands of children have lost their lives, hundreds of thousands more remain at risk of death from preventable disease or starvation, said UNICEF's executive director. According to UNICEF, over 2.2 million Yemeni children are critically malnourished, with 1/4 of them under the age of 5, and the majority at high risk of cholera, measles, and other vaccine-preventable illnesses. Yemen's civil war erupted in 2014, with Iran-backed Houthi rebels seizing the capital Sana'a. Hundreds of thousands of people have died since, either directly as a result of warfare or indirectly as a result of poor drinking water, disease epidemics, famine, and other consequences. According to the UN, the war has resulted in one of the world's greatest humanitarian crises. 3,774 children have died between March 2015 and September 2022. A 6-month truce established by the UN lasted until October 2nd, but warring parties were unable to agree on an extension. According to UNICEF, at least 62 children have been murdered or injured since then. The urgent renewal of the truce would be a positive first step that would allow critical humanitarian access, and only a sustained peace will allow families to rebuild their shattered lives and begin to plan for the future. The UN agency also stated that 3,904 children have been recruited into the fighting ranks over the years, with more than 90 girls being assigned duties such as working at checkpoints. UNICEF has requested $484.4 million to address the humanitarian crisis. If Yemen's children are to have a good future, all those in positions of power must provide their protection and support.